pregnancy with Dr. Noela. Excellent health for mother and child. Top pregnancy with Dr. Noela. Excellent health for mother and child.
Thank you all so much, and good morning to you all. I'm so happy to have you here and for you to honor this invitation. It's really an honor for me because this is actually a project which it just came into my mind. And you know, it's different when you have a dream and if you don't put it into action, they're just dreams. My name is Dr. Ngwayama Nuela. I'm a medical doctor and the founder of Top Pregnancy with Dr. Nuela, which is an organization we aim to improve the health of women, children, and adolescents and fighting maternal and neonatal mortality in the Northwest region, in Cameroon, and the world at large.
I'm a woman with disability and the leader for women with disability in the Northwest. I represent the Northwest Association for Women with Disability. When I heard about this workshop, my expectation was to gain knowledge on how women with disability can be assisted with preconception, because they are women and they want to be mothers also. So I want to gain knowledge that can support them with their diversified nature and degree of disability.
I really expect to know more on what preconception or what the actions of preconception is all about, that which has to do with the responsibilities of each partner when it comes to pregnancy. And I think as a staff of Plan International, we work with a lot of adolescents, and mostly girls who are very vulnerable or who are so prone to unwanted pregnancies. I think from here we will have a lot that will help us in our work to go along with these adolescent girls, that can also help them to know when and how or what to do when issues of pregnancy come up.
When I was coming, I thought that I would see very few participants who are eager to learn about preconception care. But I was amazed that I saw many stakeholders, people that we can actually work with, who can reach to a wider population to talk about this notion or this concept of preconception care, which is very important for us to have a healthy future generation and to strengthen the human species.
I must say that I believe that after this workshop, we are going to have a lot of women of reproductive age who would plan before they get pregnant. They would receive the appropriate care, and when they get pregnant, they will be followed up, and at the end of the day, the outcome of their pregnancies would be a vigorous, wonderful, bouncing baby who is very healthy and will be discharged home with the mother without any malformations, without any problems. And
my expectations after this program, one is for the actors, the various actors, to have good knowledge on what preconception is all about. Secondly, for them to be able to come out with solutions that they are going to help to bring out this preconception to the general public. And lastly, to bring out new projects or new ideas on how we can improve the sexual and reproductive health life of women and men.
Because most of the time when we go to sensitize, you see only women. Where are the men? And if you have to reach the men, you know where to find them. If they're in offices, go to offices. Don't go, they're in bars, go to bars. Go and meet them where you know you will meet them. Because most of the time we go to places where we easily meet women. And avoid places that you meet men because they'll be looking at you. Okay.
As of now, I can say I have really understood what it means, what preconception counseling means, what I am supposed to do, what my partner is supposed to do when it comes to preconception care. When it comes to preconception care, know the various diseases that can cause pregnancy not to develop well, what a woman is supposed to do, the kind of medical attention that she requires when it comes to preconception care, and what she can do in the process of pregnancy to ensure that both mother and child are healthy.
I want to appreciate Dr. Nuela, Talk Pregnancy with Dr. Nuela, for giving us this opportunity. I have learned a lot, and as a leader of women with disabilities, we will try to share the knowledge with our women with disabilities. We have learned a lot about actions for preconception care, and it is very fruitful because it is a knowledge that I have never had before, and it's very new. And generally, this workshop has been very nice. They took into consideration access for persons with disability and basic language that we all could understand with good knowledge that has been shared. And the facilitators have been very good with the knowledge they have shared with us. I think for the community of persons with disability, I have knowledge now, full package of knowledge for preconception care, on actions for preconception care, on medical services or medical aspects that we neglect or we take for granted.
Yeah, thank you very much. We have a very wide range of disabilities that are identified in medical practice today. What we must know is that about 60% of disabilities are caused by chromosomal malformations. Or in other terms, we don't know what actually causes them. They just happen by chance during fertilization and development of the embryo. And we have a small percentage which is due to medicines that people take or other drugs that are exposed to or toxins that are exposed to. And a small fraction, about 10%, are due to these genetic diseases. So a few fraction of these diseases that we have, which we can call disabilities, are genetic, but not all of them are genetic. So we encourage strongly all those who have these disabilities to come and consult. Let us try to determine the cause of their disability and determine from there if it is genetically transmissible or not, and get them, look for a way forward for them to have healthy pregnancies.
APCARE, it's a concept that I didn't really understand, but I want to tell you that now I am very full, because APCARE, it has to do with nutrition. I mean, before conception, I didn't imagine that there are certain things we need to do before we even before conception.
So taking measures like the folic acid we talked about can prevent a lot of congenital malformations that occur in babies. So we encourage any woman who wants to become pregnant, whether living with disability or not, to receive folic acid for at least 1 month before they conceive. And when they conceive, they have to continue for at least 3 months during their pregnancy. It will help a great deal to reduce some of these malformations that they can have.
So excited that APCARE is now a reality, and I can't overemphasize on the amazing lessons we have learned here, and also the contributions from all the other organizations that were here present, and with the honor of the focal point person for sexual and reproductive health in the Northwest and the assistant regional delegate of the Northwest. It was really an honor for us. And we just want to say we have reached our objectives, and those who came here can testify that they have learned a lot from this, and this is a new concept, and we are ready to take it out there.
I'm going back with a lot of knowledge. I have learned a lot, and I will be intending to disseminate this information with my other colleagues and in the communities in which we carry out our interventions.
I'm going back so fulfilled, and thanks to Dr. Nuela with Talk Pregnancy, because we've had a lot from the medical touch.
And I want to tell us that everything is to start. She used her condition, the cesarean operation that she had, to have this baby. And she told me, does it mean that if I were not a medical doctor, they would not have rushed me to the theater urgently? I would not have had the services that I had? So what happens to a woman in the village who has this problem, but who has no opportunity to be attended to? That is the focus on which, the background for which she is coming with Talk Pregnancy. So that other women should have access to urgent treatment in the hospital to save the life of the mother and to save the life of the child.
So I believe that the preconception care workshop is really timely, and I believe that it will go a long way to reduce a lot of congenital malformations, a lot of preterm deliveries, and a lot of neonatal mortality in our community and our region.
And our future plans is to reach out to all people out there, all the communities, through radio programs, through online sensitization, through targeted community outreach programs, and extending it to other regions in the country. So thank you very much, and I'm so excited. APCARE steps to a healthy family.